And we say welcome to you all. This is the KSU's Research with Relevance Friday features, and we've got a great show today. This is our almost finished season. We've got one more show next Friday that we'll talk about at the end. My name is Phaedra Corso, and I'm the Vice President for Research. And we've been doing this show for a couple of reasons. One, because it's nice for us to check in and see each other's faces. It's a way for us to stay connected as researchers and scholars. It's a nice way to end a very long week for most of us. And to celebrate the weekend starting at 5 o'clock. So I thank you all for being here. So a few housekeeping tips before we start, which you've heard me say many times over. And the first is to mute your mics when you're not speaking. So thank you for that. Also to remind you that if you want to pin one of our speakers, there's 3 dots next to the person's name that they will be featured on your screen. And then also that we are recording this as we have all the other events that we've had, and we will be posting on YouTube later this afternoon if you want to take a look at it. So our schedule for this next hour is the same that we've been doing, which is that we'll show a short video, and then we'll go into a period of time where I ask a few questions. During that time period, we invite the participants to send in questions through chats if that's comfortable for you, and if you have access to that, and if not, then you're welcome to just jump in and ask questions. And so that's the format, but before we get started with that, I would like to turn it over to Natasha Williams, and I can see her shining face right there. We have a new initiative that we're launching this summer because we don't have enough to do, and we just want to find one more thing to push us even more. And so, Natasha, I'm going to mute my mic and turn it over to you for a few seconds.
Okay, well, thank you, Phaedra. I am not going to talk very long. I just want to bring to everyone's attention that we are starting our push to expand our use of Pivot. As many of you know, Pivot is the system that we subscribe to that allows you to be matched to funding opportunities, to do funding searches, to have those searches come directly to your mailbox. Many of you have probably received funding opportunities from me out of the Pivot system, as I've worked to try to match you up to funding opportunities that would be appropriate. And so now we're moving on to the next phase of our use of Pivot, where we're asking everyone to please go into your Pivot profile and to fill that profile out completely. We want to begin to use the profile part of Pivot to be able to help you find collaborators. As we get opportunities in, we're able to help pull together collaborative teams. Oftentimes we will get, requests from faculty members who see a great opportunity and they want to be able to identify a collaborator on campus that they can work with. And so this is how we're going to accomplish that. So we're just simply asking if you will please go into your Pivot profile. Joelle has put our campaign postcard up on the screen. We also have the information on our website. As always, you can email me to set up a meeting. I can help walk you through setting up your Pivot profile. If you haven't claimed it, I can send you the instructions for how to use Pivot. We've put together a Pivot guide. And so we're just really here to support you in helping everyone across the campus get their profile done, get it into Pivot, and we can begin to expand our use of it for collaborative purposes and for building interdisciplinary teams. If you have any questions, please do send me an email. Please do send an appointment, and also be looking for us to begin to come into your department, college by college and department by department, and reach out to faculty as we see that there are profiles that need to be filled out. So that's all I have. I hope everyone has a great Memorial Day weekend. Eat lots of barbecue, and stay safe and wash your hands. And with that, I will turn it back over to our fearless leader, Phaedra Corso.
Thank you, Natasha. So we have affectionately named this the Pivot Profile Push because I like alliteration. And so I've really challenged Natasha to get every single faculty member at KSU in this system so that we can really create the best networking possible. So please help her out with that by reaching out to her and getting your profile in the system. All right, enough of shameless marketing. Let's turn it over to our featured guests. So we have two guests today. The first is Dr. Katherine Ingram. So Katie is an associate professor of exercise science in the Department of Exercise Science and Sports Management. Katie was also part of our first cohort of summer research fellows that we ran last year. And that program, for those of you who don't know, is to help faculty successfully pursue external funding. And we're not quite there with Katie, but we are on the edge of that external funding. And we're so close, I can't wait to be able to announce it sometime soon. Katie joined KSU faculty in 2012. She serves as the founder and director of the KSU for Fit Kids program, which hopefully we'll talk about a little bit later, in which KSU student volunteers promote healthy lifestyle choices to local children. Oh, that is... Sorry, that's my children wondering where dinner is. Let me just go ahead and turn that off. So Katie joined, yes, I said that already. So Katie studies the impact of gestational obesity and inactivity on maternal metabolic health, which is the topic for today. Okay, I have absolutely lost. Heather, will you confirm to me that you can still hear me?
Yes, I can still hear you.
Okay, I've lost video, but no worries. I'm just gonna.
I can still see you too.
Okay, fantastic. I can't see anything on my screen anymore, but I'll just keep going. So Katie earned her PhD in exercise physiology with a concentration in nutrition from Georgia State University. Our other guest today is Janeen Amason, and Janeen is an associate professor in the Wellstar School of Nursing. She is also assistant director of the undergraduate program in nursing. Janeen has taught at KSU for 16 years. Thank you for that, Janeen. And she has over 28 years of nursing experience. My phone is blowing up. In women's health, care of women during pregnancy and postpartum, newborn care, prenatal education, and nursing education. And Janeen's research interests include gestational diabetes and the increased risk of type 2 diabetes in women diagnosed and the increased risk of obesity, diabetes in children exposed to high glucose levels during pregnancy, which again is the topic of our conversation today. Janeen earned her PhD in nursing from Georgia State University and her bachelor's in nursing from Auburn University and her master's degree in nursing from Troy University. We're super excited for the both of you to be here today. And I'm going to, don't know what I'm going to do with my computer, but we're going to go ahead and run the video now. Thank you.
I have wanted to understand obesity since I was young and saw my family members struggling with their weight. I used exercise to maintain my own weight, and this interest ultimately led me to study exercise physiology in school. For several years after completing my master's degree, I designed exercise programs and counseled individuals at fitness centers. I observed that most people wanted to lose weight and that this was a lifelong struggle for many of them. During my doctoral program, I began to appreciate that obesity is a very complex disease. As people become obese, fat can accumulate within muscle cells, around the organs, and even within organs such as the liver and the heart. This fat accumulation is closely linked with cardiometabolic disease like diabetes and heart disease. And many of the cellular processes driving these relationships are still poorly understood. Wanting to know more, I spent a semester visiting another university to study intramuscular fat accumulation in diabetes. This experience shaped much of my research program today. My postdoctoral fellowship focused on clinical trials for treating obesity. My research showed that it is extremely challenging to treat obesity in adults, as they appear to be resistant to making necessary lifestyle changes. When adults with obesity become pregnant, they are much more likely to have children who also struggle with obesity. This is partly due to genetic predisposition and partly due to the lifestyle of the family. What's even more concerning is that obese children are 5 times more likely to become obese adults. This leads to a vicious cycle that researchers call transgenerational obesity. The purpose for my work as a scientist is to eradicate transgenerational obesity by resolving gaps in knowledge that will lead to the development of effective lifestyle interventions. I recall the aha moment I had when I realized that the most influential time to intervene is likely before the child is even born. Pregnancy is a unique time in a woman's life when she is more motivated to make lifestyle changes to improve the health of her baby. Obesity in pregnancy is one of the strongest risk factors for gestational diabetes, a very serious complication of pregnancy. Children born from diabetic pregnancies are much more likely to be obese and to suffer from diabetes as well. It was clear to me that young women are going to need help during pregnancy to mitigate the impact of their obesity on their children. When I joined Kennesaw State University in 2012, I began developing a research program focused on obesity and diabetes in pregnancy. I soon met Dr. Janeen Amason, an expert on women's health and obstetric care in the Wellstar School of Nursing. Janeen worked with me to launch a line of research using novel measures of obesity during early pregnancy to identify women who are at risk for diabetes later in pregnancy. Most of the time, gestational diabetes appears at around 24 to 28 weeks, or a full 6 months into pregnancy. By the time a woman finds out that she has diabetes, it is often too late to make much of a difference with a diet and exercise program. We are testing the use of a simple ultrasound measure of abdominal fat to predict risk for gestational diabetes. The findings from this research will enable clinicians to identify high-risk patients at only 12 weeks of pregnancy. Our pilot studies on these measures have shown very promising results. Once these are established, our future studies will test lifestyle interventions using diet and exercise throughout the pregnancy to help patients who have been identified as high risk. We conduct our research within the exercise science laboratories in the Wellstar College of Health and Human Services. The physiology laboratory contains multiple testing rooms and a large array of state-of-the-art equipment that can be used to collect almost any measurement we could possibly need pertaining to body composition, cardiorespiratory fitness, and skeletal muscle. The biomarkers laboratory is used to process biological samples and quantify specific proteins or other tissue markers. This research provides a robust learning experience for KSU students. We typically have 5 to 8 students working to assist us at every level, developing protocols and writing grants, recruiting and testing subjects, and presenting our findings at scientific conferences. The overall goal of this program is to identify high-risk women much earlier in pregnancy and to improve the diet and exercise programs that they are prescribed. We believe that these steps are needed to improve care for women struggling with obesity and to mitigate the effects of obesity during pregnancy on the child.
Okay, I hope you can hear me. Katie and Janine, I can see you, so that's wonderful. Thank you for that. My first question, and I think this is an obvious one to anybody who's watching, which is that you've demonstrated, of all the shows that we've done so far, you're doing research with human participants, and that's a fairly rare phenomena for much of the research that we do at KSU, and it's wonderful. How are you being impacted by COVID-19? Maybe things are slowed down now, but just in thinking about now, but also what you plan for the fall and trying to get these women to come in and do the research that you want to do. What are your plans?
Well, it's kind of strange to hear myself saying this, but if there is ever a good time to have COVID coming in and causing disruptions in research, I suppose now is the time, because at the moment we're in program development, and we plan to bring human subjects into our lab in the early part of next year, but we don't have plans for this year. So in the interim, we are involved in some studies that don't involve contact at all. We have a survey study that we're using. Let's see, I sent a slide to Heather that we call affectionately the MAMA study, which stands for maternal activity and movement assessment in pregnancy. And so this is a survey study that will help us to collect data on pregnancy regarding how exercise is related to better health in pregnancy. We're looking specifically at risk for conditions of pregnancy, like diabetes, which is something that we study in our lab, and other conditions, preeclampsia, and a variety of things that are issues. We also are interested in how exercise might help in making delivery easier too. So there are a few things that we're getting at with that particular survey study. In addition, I do a lot of work with the Cardia Study. I think I put an image on one of those slides. The Cardia Study is a long-term NIH-funded epidemiological study that has been collecting data on over 5,000 people since 1985. And what they're doing is testing them every 5 years and determining what sort of factors people have in their lifestyle that might influence their risk for disease. There's an entire group within Cardia that studies obesity and diabetes that I work with, and there's another group within Cardia that studies specifically pregnancy. And so we take the data that is available from these 5,000 people, and we can conduct studies using the data set without even having to be face-to-face with any subjects.
Yeah.
So these two studies provide a lot of good preliminary data that we can use to support our clinical studies that we do in our lab.
Yeah, thank you for that, Katie, because that is one question that we get all the time, which is, how does research keep going when we're in the midst of this pandemic? And I think the answer is it does keep going. You find alternative uses for your time, doing secondary data analysis, collecting data virtually from your participants. So that's a great explanation. So Janine, I want to turn it over to you. So you're in the nursing school. Tell me first of all, how did you and Katie meet, and what is kind of your role in the research that was described in the video?
Okay, great. Katie and I met somewhere around, I guess, 2013. I was just completing my PhD at Georgia State about that time, and my dissertation work had focused on gestational diabetes. And during that time of my research, I've always been passionate about moms and babies and families from the time that I was in nursing school. And so to be able to kind of switch and really focus on a particular area of their health was really interesting. And when I was working on my dissertation and focusing on gestational diabetes, I was really kind of blown away at the possibility and really looking at the stats of women who were diagnosed with gestational diabetes converting and developing type 2 diabetes in their lifetime. Because for many years in my role as a nurse, we basically said once the pregnancy is done, there's no longer consequence if they've been diagnosed with gestational diabetes. And unfortunately, what we have found is that over half of them will develop type 2 diabetes within 5 to 10 years of their delivery. So that's where my interest started, was because I was thinking, we've got a lot of young women who are developing type 2 diabetes and are going to have more of a lifelong problem because there's a lot of complications, as we know, when someone has type 2 diabetes. And so Katie sought me out, and she saw that I had the interest in gestational diabetes, and so we've been working together. It's really kind of neat because we come from different departments, of course, and so we look at things differently, which is a good thing when you're collaborating on research. And I think it really strengthens our research because I'm really more clinically minded. The so what, how is this going to help my patients? And so I think it really strengthens that research with us coming from different disciplines.
Yeah, no, I totally agree. It's interdisciplinary research is what it's all about. And so we're glad for you all to show us a great example of that. So Katie, let me ask you, one of the things I heard in the video was I was wanting to hear more. So you made a comment about how infants who are born to moms who are obese have a greater percentage of obesity as they age. What is that percentage? And does it vary by different demographics?
Well, let me see. Heather, I sent you some slides with statistics. Would you mind showing some of those? So, when women are obese and then develop diabetes in pregnancy, like I said in the video, there's a much greater risk that their child will also struggle with obesity and diabetes as well. And what's really alarming is that it's over 47% of type 2 diabetes in children has been related to this intrauterine exposure, or what they were exposed to when they were in pregnancy, before they were born. And will you move to the next slide? Thanks, Heather. So one thing that is happening is, along with obesity climbing so much in the country and worldwide, we're seeing also elevations that are happening in the prevalence of pediatric diabetes cases. They climbed more than 30% from 2001 to 2009. And the projection is that they will still increase more, even fourfold, up until 2050. So it's clearly an important problem. Will you go to the next slide? Something that I think is very relevant to what we study is, recently the CDC announced that Georgia has the highest rate of maternal mortality. So such conditions of pregnancy are really pronounced here in Georgia. So I think this is a good opportunity to study this population. So
let me cut in and ask another question, Katie. Maybe you've got the stats here, but let me just ask the question. So your research is really focusing on a diagnostic tool, right? You've come up with this ultrasound that is able to identify risk for diabetes way earlier than any other current practice. So what does one do with that? What do you hope to learn more about that one diagnostic tool? And then once you've learned that, where do you go next in this research?
Right. I study obesity, and I measure body composition in countless ways. I'm very interested in this ultrasound measure of abdominal fat, because one thing that we know about abdominal fat is that it's a very strong indicator that there's something wrong with the metabolism, and that's what diabetes is all about. What we are doing is testing the use of an ultrasound measure of abdominal fat So when a woman goes to her physician and starts undergoing prenatal care, they use ultrasound devices to follow the baby. And the same ultrasound device can be used then to take measurements of abdominal fat. And then our goal is to use these measures of abdominal fat to predict who's at highest risk for gestational diabetes later in pregnancy. In our lab, we study all different components of diabetes too, because it's very multifaceted. So we study what happens at the level of the beta cells from the pancreas that secrete insulin, and we study how that influences the overall insulin sensitivity or ability for the mom to utilize glucose. So these metabolic measurements.
But in the research trajectory of this world, what does it take to go from what you're learning as, hey, you're already doing this, might as well go take this extra step and measure the fat, to changing clinical practice? Like, how does that happen in practice?
Yeah, well, so what I envision happening is, first, we're identifying these relationships, and we're not only using abdominal fat as our predictor, we're also using measures of sedentary behavior. So we're very interested not only in these obesity measures, but also how is a sedentary lifestyle also influencing this? And our goal is to ultimately test these measures and utilize them to create a prediction tool that clinicians will be able to use within the doctor's office. So they would be able to take these measurements at about their 10 to 12 week visit and then determine who's at highest risk. And so right now we're in the early stages. We're recognizing that these relationships are here. They're very strong. We're in the process of launching some studies to quantify these relationships. And once we've been through those testing activities, then we'll later seek to start something like clinical trials, where we'll take women who we identify as high risk based on our tools and develop interventions, test and develop different interventions to see what we can do to prescribe to women who we recognize as high risk.
Mm-hmm. Good, thank you. I'm going to open it up to questions. I see, Scott, your face popped up. Did you want to ask a question?
Boy, you're really good at targeting people that you know they're going to come on to ask a question. Usually it's Ian first, but I'm going to ask the first question.
He's at the doctor's office. That's why he's not here today.
Okay. Katie and Janine, great job. And, you know, of course, we're very proud of you. And I know what great work you do in the college. So I'm going to ask a question that's impossible to answer, but it'd be nice to hear a professional opinion. Obviously, the in utero environment is determined by the mother's genetics as well as her lifestyle, and but a lot of times they go hand in hand, correct? So, you know, if you were able to tease out, say, a woman who's genetically prone to diabetes or obesity, but were to have an extremely healthy lifestyle for 9 months, how much can she reduce the risk of her child getting into one of those categories for obesity and diabetes? Do we know the effect of that yet?
Well, studies are mixed. So no, I don't. To my knowledge, we don't have any tests now that look at genetics, and we can't. I don't believe that they're yet targeting women based on genetic predictors, but there have been a lot of clinical trials on different interventions in gestational diabetes, and honestly, they've had mixed results. There are a lot of people who think that you can't use exercise during a pregnancy to impact the risk for gestational diabetes later. We have found that women who come into a pregnancy already fit have a very low risk or much lower risk for developing gestational diabetes. My opinion is that a lot of exercise programs in the past have been very mild, very low intensity exercise programs. And the current information shows that pregnant women are able to tolerate a lot higher amount of exercise than we thought before. And so what I suspect is that the exercise interventions haven't met the right volume of exercise to make a huge difference. It's very mixed, though. There are more of the recent studies looking at exercise interventions on gestational diabetes are very promising in that regard.
Thanks.
Okay.
I know it's hard to tease out the percentages. Thank
Yeah,
you.
definitely.
Okay, and we've got a question that follows up to Scott's question, which is, what about a child who's born to a mom with gestational diabetes? Through a healthy lifestyle, can that positively impact their odds of getting diabetes in the future?
Absolutely. Whenever we're seeing with those interventions, it does make a huge difference. And so that's one of the reasons why targeting our women earlier in the pregnancy to engage in those healthy lifestyles is going to decrease the amount of glucose that baby's exposed to. So the reason why, we're so concerned with that is because you guys hear about the large babies that are born, the 9, 10, 11 pounders. It's because when they're exposed to those high glucose levels, they deposit it as fat. It's not going to be utilized in any other way. And so that brings those complications, of course, to mom for delivery. But we know that the longer that baby's exposed to those high glucose levels during pregnancy, that increases the risk of the lifelong complications of obesity and diabetes. So if we can, decrease that level during pregnancy any earlier than what we're looking at, that 24 to 28 weeks, whenever we're doing the diagnosis, then that's going to be a better outcome for the kids. And so, of course, we want mom to continue those interventions even after pregnancy, because that's going to decrease her risk of type 2 diabetes as well. Most of the time what happens is that we'll do this for the health of our baby. We'll make those healthy lifestyle changes, but then once baby's born, we go back to our old habits. And so that's something we really have to emphasize with our moms.
This is a question that comes from an engineer. Are the ultrasound measurements of abdominal fat determined manually, or are the ultrasound images recorded and then processed by computer?
Right now, they're done manually. Well, it's sort of half and half, because the measurements are within the software. There are calipers that you can use to measure from point A to point B. And so we create a still image. Once we find our landmarks, we create a still image, and then we're able to measure that by dragging the tool. So in part it's manual, but then the software itself makes the calculation.
Mm-hmm. This is a good one from Returns on Investment. This question is, how much additional time does it take to make the measurement of abdominal fat during a routine prenatal ultrasound exam? This gets to whether we can actually get clinical practice to change or not.
Less than 5 minutes, I would say. They're already utilizing an ultrasound device on the abdomen to measure the baby. So most technicians are very well trained in finding the landmarks that they need for the baby. So if anyone can find exactly where to measure and between which 2 points, the technicians are very good at that. So I think that it would be a really simple thing to throw into a visit, a prenatal visit.
I want to ask a question about your partnership as an interdisciplinary team. Are there others at KSU that you're working with, Katie, or maybe outside of KSU? And kind of what is your hope for your collaborative experience at KSU? Because I think there's lots of opportunities here. It's such a great topic.
Yeah, well, the topic of obesity in general is so huge and interdisciplinary. Nearly, I think almost any discipline has something to do with studies in obesity. When it comes to our collaborators, we collaborate with some people in exercise science who help with analyzing our blood samples and identifying our proteins. Dr. Brian Klashevitz is one of them, if he's on the call. Let's see, in nursing, we have, and one of our earlier collaborators is Becky Chabot. Outside of Kennesaw, we have collaborators that work with us from Emory. We have someone who's a professor of the Division of Endocrinology in the School of Medicine. And we have collaborators at UAB. Dr. Barbara Gower is an expert in the metabolic measures that we use. We collaborate with a variety of other researchers that are out there. And in the other studies that we work on, we have collaborators with our survey study, the MAMA study that I was describing from Emory. And I collaborate with a lot of researchers all over the country in the Cardia studies that I do. Okay, what I would love to see happening at Kennesaw State is developing a larger collaborative interdisciplinary group who could come together and bring all their expertise to continue studies in obesity.
Great idea. I feel compelled to ask this question because it comes from our president. Are you working with any health communication experts to integrate potential communication campaigns or strategic messaging?
I'm not, but I should.
Good answer.
I think I will.
Well, I think it just speaks to, touching so many different fields. Obesity is this huge umbrella under which so much research needs to be done, including health communications. So, yeah. Anybody want to jump in and ask a question live as opposed to through chats?
I have another question. And so this is not your areas of study, but maybe you know some of the latest in this area. Several years ago, the field of epigenetics started really focusing on, and I'm saying this because as a man, I don't want us men to get off free in this discussion. It's more, so the field of epigenetics discovered it's more than just the in utero environment, that male lifestyles can affect the DNA and the methylation of their sperm DNA, that it affects the child's gene expression and the child's health after, in childhood and later on in life. So the male lifestyle, it's not just the woman. So I wonder if there's any more information on that. I know it's a statement and not a question, but I didn't want men to think that they're not responsible for some of the child's health.
Yes, I agree. You're right. And also that's not exactly what we study, but I have seen a lot of very exciting research looking at epigenetic programming from both the men and the women. And I guess for those who don't know about epigenetics, it has to do with the way that your lifestyle can modify your genes to pass down to future generations. And they're small modifications that many of which can be temporary. So in terms of one generation or one lifespan, and they can be modified with changes in lifestyle.
There's a comment here from Dean Long that you should reach out to the health communication scholars in his college. So I think that's a great suggestion. But there's also another question that's come in. It says, I've been reading about how the microbiome can impact obesity. Are you studying any of that related to this research?
I love that question because yes, we have, I have a colleague at University of Florida Medical School who does microbiome of pregnancy. And we have talked about adding a microbiome component to our current study. I think that that's a really new opportunity, and a lot of people are very interested in the microbiome. There are some things that we've been considering about studying related to diet, and dairy consumption is one of our interest areas, and its relation with the microbiome.
And I always want to ask a question about students because that's where it's at KSU.
Mm-hmm.
You did talk in the video about several students. I guess my question is related to who are your students? Are they only nursing students? Are they only exercise and sports management? I mean, are you bringing both in? Have you brought any in from outside your college? What are the opportunities there?
Well, we have a good mix. So we always have a lot of exercise science students. They're very interested in our research. We tend to have a pretty large team of exercise science students, but also our research grabs the interest of students from biology. We get a lot of pre-med students, and right now our team consists of 3 exercise science students, 3 biology majors, 1 biochemistry major, and 1 psychology major. and so it runs the gamut, and I love it because it brings this interdisciplinary discussion into our research team meetings.
That's great. Where are the nursing students, Janine?
Well, I'll tell you what, we've got to do a little bit better job of engaging them in research. The program is very busy and very rigorous, but we have had some interest in the past, and so hopefully we'll be able to engage our students even more so in the future.
How about some of the community work? You mentioned the program in the community, and maybe you could give us a little bit more information on that, Katie.
Sure. So what I do is I'm very interested in not just what happens during pregnancy, but fitness and obesity over the lifespan. And I started this program called KSU for Fit Kids. And this program motivates our KSU students, primarily in exercise science, and gives them opportunities to go out into the community and work with children. Often they go to schools and they sit in a classroom and they talk to kids about exercise and healthier eating. Or what this shows is an event that was held on campus where they bussed a couple schools of children in for a game. It was a midday game, and they brought all these children in, and our students from exercise science gave them a lot of activities to participate in and got them motivated and handed out prizes. And our prizes were jump ropes and pedometers to encourage continued interest in exercise. And it was a lot of fun. And I think that the program that we have in exercise science is wonderful for this because we have some 1,000 exercise science majors in our program. And this gives them a wonderful avenue to go out and experience how they can make a difference in the community.
So do you have this as part of a service learning component for one of your courses?
I do. I've gone about this in a couple different ways. So in some of my courses, I will offer this as an assignment that they can do to essentially earn credit for being engaged in the community. I also will provide opportunities for students to be involved as a service learning program itself. We haven't had any students that have fit into that position yet, but that's my hope that we'll be doing soon.
Other questions from our live participants?
Hi, yeah, I had a quick question. This is Brian Klashevitz. Just maybe a possible way to get more nursing students involved. And I don't know if this will maybe involve the OBPR's office or not, but maybe having an organized phlebotomy training session. And the more we get some of the students trained through phlebotomy, we may be able to kind of coax more nursing students to come in and assist with some of the blood draws. I know that's been something we've talked about before, but never really pulled the trigger on.
Yes, there's going to be a lot of different ways of engaging the students. The ones that we've had in the past, once they were in the program and saw their calendar, they had to kind of pull away from being part of the research. So we need to do a little bit better job of finding ways for them to see that it's valuable as well. And so that is something we definitely could work on as a department, but that's a very good idea, Brian. Thank you.
Thank you.
Other questions from the participants? Okay, well, I'll ask another one because I have about 40 more that I'd like to ask and not that much time. So, you know, I'm not sure how many people on this campus realize the extent to which we do research in Prelim and Hall. And you all have some pretty amazing equipment and, you know, the lab work and the people in those labs. And I wonder if you could talk a little bit about how, what you're doing, how you're doing it, where did the equipment come from? I think the pictures you showed were pretty amazing.
Yeah, well, in our current studies, we bring the women into the lab. We give them a 2-hour glucose tolerance test with a lot of blood draws involved in that. We also then measure their body composition in a variety of different ways. We have a DEXA machine, which can tell body composition in terms of how much body fat they have, muscle mass, bone, and it's a good measurement of bone mineral density. We have a variety of other equipment in there to tell all kinds of different body composition measures. We have the ultrasound machine, which I've already discussed, but I use it to measure abdominal fat, but it can be used to measure different aspects of skeletal muscle tissue. So it's used to look at different aspects of muscle. We have a variety of fitness equipment too, so that we can test cardiorespiratory fitness and a lot of different other things that go along with that. One thing that we use also to test is accelerometry, and some of you may have heard of that. What we do is we put a physical activity monitor on the person and send them out for several days, and we can track their physical activity with minute-by-minute data over the course of a week. And then we can utilize that data to determine what % of their time they spend sedentary or engaged in a low level of intensity or moderate or high level of intensity.
And so how are you recruiting? Because I can imagine that if I am a pregnant woman, if I'm unhealthy, overweight, I'm not going to be interested in going into a study where you're measuring my fat content. So how do you deal with self-selection bias in your recruitment?
First of all, we very carefully phrase our announcements so that it really doesn't point to fat or exercise. We're careful to say this is a study on maternal health, and we're interested to know whether how much exercise or rest people do. We want to make sure that we don't scare anybody away for that particular reason. And the place that we recruit from, we have clinics. Dr. Amason is involved in some clinics that allow us to recruit, and we have several other partner clinics around the Atlanta area. But really where I expect that we get the most recruitment from is social media, because that goes out to the whole Atlanta area and people are excited to send it to their pregnant friends and family. And so that's where we get most of our women.
And do you feel like you get a good representation of the demographics of at least our state?
Probably not as much. There's not as much diversity as I think that we would like to get. So we tend to get roughly, I would say that our pilot studies were roughly 70% Caucasian, which does not really match the demographics of Georgia, but it does match the demographics of East Cobb. And I think that one of the ways that we can recruit other demographics is I have a partner, a collaborator who works at Grady, who might be able to help us with recruitment there. And I have some other collaborators that work in other medical centers. So we're going to reach far and wide on our next study and try to recruit from all aspects.
And I just wanted to add, when we first started our research, we were out of a physician's office. And so we were very limited on recruitment because some of our studies, like ultrasound and that type of thing, was being done in the office. Now that everything is in one place in Prevalence, this is a huge resource for us, and it opens up our recruitment because they're able to come to one spot and we're not just kind of pigeonholed into one place that we are doing our recruitment. So it says a lot that the university has supported and been able to get all of this equipment and everything that's needed here for us to do our research right on KSU campus.
Yeah, thank you for saying that, Janine. Unless there's one more burning question, this is your last chance. I think we're going to wrap up. So I just want to thank the two of you very much. This was, it's really exciting research. I feel like you are showing that that KSU is doing some really cutting edge interdisciplinary work, highly fundable by NIH. We've got our fingers crossed for that.
Thank you.
And we just want to commend you for all the great work that you've done. To our participants, we just want to say thank you. It is the Friday before a long weekend. And so, bless you for being here with us today. And we hope that everybody has a wonderful weekend. We do have one more Friday's feature show next Friday, and we're going to be talking about IP. And for those of you who don't know, we've had some success with intellectual property development at KSU, and we'd like to talk with you a little bit about that. So we're going to be talking with Jonathan McMurray, who's the co-founder of the New Echota Biotechnology. We're going to be talking with Greg Quinnett and Burton Cowden, who are from the Shore and Entrepreneurship Center and the Coles College of Business. And that will be the last show, if you will, for the season, and we'll bring it back again in the fall. So from the Office of Research, we want to thank you, Katie. We want to thank you, Janine. Thank you to our participants. I hope you all have just a wonderful, safe, and healthy and long weekend. It is well deserved.